The broadcast is now starting. All attendees are in listen-only mode.
Good morning, ladies and gentlemen, and welcome again to the California-Nevada chat here on Friday, December 4th. We hope that everyone had a happy, enjoyable, and to a large extent restful Thanksgiving break. And my name is Len Dumas, Executive Director for the Northern California section of the PGA. And certainly, as we discussed last time 2 weeks ago, much has happened, and certainly this week is no exception, if not even more, in terms of COVID-19 and everything that's come out, which we will get into in pretty good detail today. We're fortunate to have as our speakers today, Director of Government Affairs for the Southern California Golf Association, Keller, and joining us for the second half this morning will be Dr. Bella Matias, the health officer here in Solano County. And again, as we mentioned, at a very high level, Governor Newsom, and not only have most counties gone to purple and some never leaving purple, such as Los Angeles County, but now we're broken into 5 regions in regional stay-at-home orders, and Governor Sisolak of Nevada has announced that they expect the first arrival of the COVID-19 vaccine doses next week. So, varied news. There is some good news in all of this, and we'll talk about that as we go along. So another point, this is our final session for 2020. So we really appreciate all the tremendous support from everyone, and we'll talk a little bit about that in a moment, for all the participants and the attendees during the course of the year. We've been through a lot. It's only 9 months, really the middle of March since this all began, but it feels much, much longer than that. I think that's an expression of what an emotional toll this has been for us as well. But first, our thanks. Our thanks to our Southern California colleagues, Executive Director and Chief Executive Officer Tom Addis, Assistant Executive Director and Chief Operating Officer of the Southern California PGA, Nikki Gatch. Bryce Seaver. Bryce is our producer and keeps us on air with Tyler Miller and Caitlin Doyle, keeping track, making sure the electricity is on and that you can see us and hear us. So let's get started. And at this point, I'd like to turn it to our Northern California PGA President, Didi Moriarty. Didi?
Thanks, Len. Thank you, Tom. Once again, it's always nice to be able to just connect. It's great to see so many people calling in today. Our world keeps changing and we have to adjust. I've found myself thinking about my parents quite a bit, who are no longer with us, but they were in that great generation, and just thinking of their toughness and that generation's toughness and the advice they would give us. So I know we're all tough too. We'll just do what we have to do to keep ourselves, our families, and golf safe, and just go forward from there. So thank you, Len. Thanks, Tom.
Okay, thank you, Didi. And now, Mr. Tom Addis. Tom?
Yeah, good morning, everyone, and thank you, Didi, very, very much. Thank you, Len, and thanks to everybody. And I echo Len's, excuse me, thank yous to Nikki and Tyler and Bryce and Caitlin and everybody else. And at this time, I would like to introduce the Southern California PGA President, Mr. Tony Letendre.
Thanks, Tom, and good morning, everyone. And the best part about being the last person to be introduced is that everybody's already said all the thank yous, so thank you. Appreciate the time, and appreciate this is the last call, unfortunately, for the year. Hopefully we'll resume at the first of the year as we know more, and keeping everybody updated. So this is good information, and it's nice to see that we're always getting this. But appreciate the time this morning, and look forward to turning over and see what's new. So thanks, Tom.
Thanks, Tony. Len?
Tom, I'll tell you what, why would you like to have a go at starting the thank yous?
Yeah, we have a number of people to thank. We thought we'd spend a couple minutes just doing that, since this is the last California Nevada PGA chat of the year. And we have a lot of names and a number of organizations that have supported this chat all year long, well, or at least since March. April, have supported this chat, and we really appreciate it. And the information that we shared and were able to participate in is exceptional. And for many of us, it kept us going, whether it would have been the information that we would use to act responsibly within the guidelines and the protocols, or gave us confidence looking forward. And that was a big part of this. And golf has been very successful so far. We hope to keep it that way over the next few weeks. But because of all of the advice, because of all of the support, because of all your questions also that we've had, that's been the catalyst to us and this chat being what we feel is very successful and to help everybody. And that's been the goal, is to keep everybody informed and to help us do our business better, help us stay safe and do our lives better. And if it weren't for some of these people that Len and I are going to thank, that as well as you out there, all of our PGA professionals and those in the business. But we'd like to thank, number one, the PGA of America this year was extremely supportive and participated so well with these chats, whether it would have been or whether it was Seth or Susie, Jeff Price. Many of you might remember both Jeff Price and John Easterbrook were so informative early on with the back to business guidelines. Tom Brawley with some membership information. Scott Wellington, who's the section business operations director. Scott was on early on. Our current president, who fell in line after Susie, late October, with Jim Richardson from the Southwest section. Don Ray, who you heard from a couple of weeks ago, the new PGA secretary. Kerry Haig and his staff with the tournament department, with the PGA of America, and their important role. Barry Deach and his team from the most recent PGA Championship at Harding Park in San Francisco. And we can't thank the PGA enough for their support and cooperation and conversation during this time. We were lucky to have Joe Bedditz, the CEO of the NGF, and I appreciate that, and John Bodenhammer from the USGA, Jay Karen, who's the CEO of the National Golf Course Owners Association, and Tyler Dennis from the PGA Tour, and all cooperating, all providing information that, again, that's so important. Jeff Hart from the Southern California PGA gave us an update on his experience at the PGA Championship at Harding. So we can't express enough appreciation to those who I was fortunate to name, again, along with our staff in the Southern California PGA, and in particular Tyler and Bryce and Nikki, and of course Caitlin. So we appreciate that. One more shout out, because I don't want to forget, and I don't want to take anything away from Len either. I notice on as one of the audience in the call is Carol Pence, and Carol's the PGA of America career consultant, employment consultant for Northern California, and Carol's retiring at the end of the year. So just wish Carol the very best. Carol and I have had a long association, both as friends and fellow staff persons. And Carol, thank you and good luck to you. And we appreciate everything you've done. Len, thanks.
Great, and thank you so much, Tom. As you say, we are very fortunate to not only have access to these people, but to have them join us pretty much sometimes on very short notice with everything they've got going on, which is pretty much everything that's led up to this time. You know, additionally, we had advice from people in industries. Remember back in March and April when we were talking about unemployment and we were talking about health benefits based upon separation of employment, and we were talking about payroll protection programs, and we were talking about emergency disaster loans, and we were talking about the Golf Emergency Relief Fund. So some of the players that again joined us and guided us, not only as a group, but answered many questions individually, with Greg Raleigh. Greg Raleigh, member here in Northern California section in the Sierra Nevada chapter. Thank you, Greg. Tony Rice. Tony, our lobbyist, literally on the steps of the Capitol in Sacramento, and for keeping us, along with Craig, in tune with what's happening. Jeff Jensen from the Golf Course Superintendents Association of America, and all the great work they did as partners in the Back to Golf guidelines. We had Mike Bryant. Mike Bryant is from Dudum Financial here in Northern California. Mike was on early to talk about unemployment issues and applying for unemployment, and so also anticipation of the rollout of independent contractors being able to apply for unemployment. Jim Farron of the Golf Course Superintendents Association of America, who recently not only became the president of CAG, the California Alliance for Golf, but is also our Northern California PGA 2020 Golf Course Superintendent of the Year, and we'll be celebrating that this Sunday. Assemblyman Phil Ting, District 14, which is San Francisco. Assemblyman Ting joined us, and we were grateful for that. The legal advice, the legal input that we received was just tremendous and quite honestly comforting. Greg Iskander and William Weissman from the Littler Mendelson firm here in Northern California, Ed Langhammer and Steve Tellis from Southern California. Dr. John Landsberger was with us a couple of times, most recently even on our last chat, and again kept us up to date. And Dr. Bellamatius, this is his third time, I believe, and he'll be on later this morning. He is, again, the health officer here in Solano County. You know, whenever, and also a shout out to now PGA of America Vice President John Linder. John was on with us a number of times, and that was great, particularly having the governor of the state of Michigan right across the street, and the mayor down the street, and everything that was going on there. And so again, our thanks to all of those people. And as Tom mentioned to Carol, I do have to say that not only are we going to miss Carol, but we did. Carol was nice enough to come in the other morning and drop off her famous banana bread, about 7 or 8 loaves, which were consumed quickly and with a lot of smiles. So thank you for that, Carol, and we'll be celebrating more of that later on in the week. So
I thought
onward.
that banana bread would fall this way, but I guess it didn't, huh?
It's probably in the mail, Tom.
Okay.
It's probably in the mail. Yeah. Okay, so let's get to it. Again, our speakers today, we'll start with the Governmental Affairs Director for the Southern California Golf Association. And actually, let me back up and just say, we also have a Hall of Fame for our California Nevada chats. And the members of our Hall of Fame certainly be Northern California PGA President Didi Moriarty, who's been with us for the duration, Southern California PGA President Tony Letendre, Craig Kessler, and Kevin Fitzgerald, who've just been with us every minute of every step of the way on this journey, which is not quite done, but is evolving all the time. So let's start off. I'll turn it over to Craig Kessler. Craig?
Well, good morning to everybody. What I'm going to try to do in the next 15 minutes is bring a little bit of sense, order, coherence to what the governor did yesterday. And also, if I have a little bit of time, explain a few details about Los Angeles County. SCGA has been conspicuously quiet about Los Angeles County because during this week, both Los Angeles County and Los Angeles City, near as I can tell, collectively, they have zigged and zagged or pivoted about 8 times in determining exactly how they're going to deal with golf under the new Safer at Home order, which is in this particular county. And so anything that we would have put out would have been irrelevant, would have been inaccurate, and would have misinformed literally sometimes within hours after we would have put it out. But first to what Governor Newsom did yesterday, try to bring a little bit of sense. Based upon the experiences at the beginning of the year, and if you recall, when the pandemic first hit, everything was geared towards bending the pandemic curve such that our public health systems capacity to deal with critically ill patients, both those critically ill with COVID-19 and critically ill with medical emergencies like heart attacks and strokes and other things, which don't get the memo to take a vacation during a pandemic, so that the capacity of our intensive care units wouldn't be so overtaxed. We're sort of back at that point again, but this time in recognition that while the counties may be the instruments of the state in terms of public health, the delivery of public health, the way hospitals actually operate is on a regional basis and it crosses county lines. And that's the theory behind the division of the state into 5 different regions for the purposes of what is going to be a statewide stay-at-home order, which is not in effect yet. Those regions are Northern California, Greater Sacramento, Bay Area, San Joaquin Valley, and Southern California. And there are many counties, obviously, by definition, that are included within each region, and they're, for the most part, contiguous. There are some interesting combinations there. Take a look at the governor's website. Take a look at a newspaper. It tends to be in them today, and you'll see which region that your particular county is in. Now, the way this works is that when any one of the regions reaches 85% plus 1 occupancy of their intensive care units in the aggregate over the course of all the counties in the region, within 24 hours, a new set of safer at home curtailments kicks in. I'll get to those in a moment. I'll just give you a review of where this stood yesterday. The Northern California region, which is not the Bay Area nor Sacramento, is perilously close and actually the closest to hitting that 85% threshold. It's only 3.6% above that, so it's headed that way. The Greater Sacramento area has current ICU capacity at 22%. The Bay Area is in the best shape, interestingly, at 25%. San Joaquin Valley at 20%. And Southern California at 21%. When any one of those regions hits 15% availability, what kicks in is a series of curtailments that are not nearly as severe as the ones from spring, in the sense that there will still be retail, both essential and non-essential. In fact, the new protocols don't really draw a distinction, but they do reduce the occupancy in some cases to 20%, in some other cases to 35%. And please forgive me if I'm wrong on a few of these details. It's a lot to consume and speak about extemporaneously. I suppose I could go through all the categories. Salons close, a number of indoor activities close. However, unlike the first go around, outdoor recreation is preferred under this. And in fact, the governor made mention how important it will be even during the darkest hours as we try to get through this final stage of dealing with COVID-19 before the vaccinations are brought out and begin to proliferate through the population. It will take a while before that happens, but with each passing day, things get better and better. But that in order to, as we get through that, outdoor recreation is going to continue to be important, and that means that golf courses will remain open under certain restrictions. And I'm going to guess that there are no restrictions at this point that have been delineated specifically at the state level, except those generic restrictions that apply to all outdoor recreation. But those may come later. And when they do, I'm sure that all of us will publish them so that you know them. But it will remain open. Now, depending on where you are in the state right now, ironically, if you are where I'm speaking from right now, Los Angeles County, we are currently under a safer at home order that would not differ from a calling of the new statewide standards in terms of golf anyway. The only difference that we would notice would be, I think, certain indoor activities like getting a haircut. Those things would be curtailed. So we're basically in that already. However, the rest of the counties that are with us in Region 5 in the state would be affected. And of course, there's a lot of concern there. Outdoor dining and various other things would go by the wayside when we hit those thresholds and this becomes invoked. And that's why I want to get to try to bring a little bit of sense of what's going on in Los Angeles County, because it may echo what happens in your county once, assuming if and when you get into the statewide safer at home order. I'm going to guess that the only region that looks like it may have even the slightest possibility of staying out of that for a period of time would be the Bay Area. And I'm a little bit remiss. What happens after 24 hours is that for a 3-week period, a series of restrictions go into place. At the end of 3 weeks, the ICU capacity, which is monitored on a daily basis, is analyzed. And if it gets on the other side of the threshold by a certain amount, the restrictions are pulled and you go back to whatever tier you were in prior to their invocation. And that's checked on every week that goes forward. What I'm not clear about is if that weekly check applies at any time during the first 3 weeks. I think not, but again, I'm not 100% positive. There's a problem with rules adopted on the fly and published quickly. They're not always perfectly crafted. They don't spend quite the amount of time on these as they do on the legislation that we more routinely deal with. So trying to move on to make some sense a little bit of what you may be reading about, which has been a mad scramble in Los Angeles County to deal with a safer at home order that permits all sorts of outdoor recreation, including mini golf at half capacity, parks, skate parks, various things, which which allow for a lot of crowding, and then reduced golf with some rather clumsy language to individuals or members of households. Now, initially, I think all the municipal systems anyway were of the mind that there was so much internal contradiction in the drafting of the regulations that they were going to interpret individuals, not literally as individuals, but individual groups of reservations of 4, separated by T intervals of no less than 10 minutes, and all the other precautions, including face coverings throughout, in place. You're in, you're out, you never see more than the 3 people with whom you're playing. But through a strange deterioration of events, LA County DPH, and I'm going to say some unkind things about LA County DPH on this broadcast today. I've refrained from that in the past, but I'm not going to hold back today. Decided to get quite literal with that, even though it was pointed out that they would be prescribing things in the great outdoors of hundreds of acres of golf courses that they were permitting on packed small acreage parks. But they kind of circled the wagons, and people need to understand at this moment their answer was no to any question. Before you were born, the answer to your question, whatever it may be, it doesn't matter what the question is no. So that's why there's been so much scrambling, and that's why there's been so much zigging and zagging and reconsidering, and why we haven't put out any information, because, but I do think in a funny sort of way, they have landed on something that makes a great deal of sense, in that they're not really restricting things to members of families, but they are guaranteeing that no one who plays a public golf course or a municipal golf course anyway plays with anyone else. At maximum, you will be with 3 other persons who you choose to be with for the duration, and you're only with those other 3 other persons. You all have face coverings, and you're all off that you never see any other persons while on property. And when you come off the 18th green, you're thanked for coming out and then told to please leave as quickly as possible. And on your way through the parking lot, don't stop and loiter or talk or do anything else. And I think that's probably a good solution. My hope would be that LA County Department of Public Health actually sit down with their Parks Department and work that through in a very specific language, so that it's very definite and very clear to everyone, because it makes a good deal of sense. And it would actually make what I just described and what they're technically de facto doing today without incident and problem is much less possibility of gathering or interaction with anyone than is currently being permitted at parks, and are likely to be permitted at parks and open spaces and hiking trails once all of us, probably all 5 of the regions in the state, get into this new statewide protocol. So it makes eminent sense. I'm really happy that in a few minutes, Dr. Mattias is going to be on, because I've said this before. He has been I'm really grateful that he has chosen to share his insights as a public health officer. I know that it's been a pleasure in Southern California dealing with a lot of public health divisions, dealing with Office of Emergency Services. We've always been able to get their attention and enter in a dialogue. And again, this is the unkind thing I'm going to say about LA County Department of Public Health. And I think it has repercussions longer term. And that is, they have never wanted to talk to the golf community from day one. And that's why from what I can tell, have not really wanted to speak publicly with any of the communities. And I think that's one of the reasons that there's almost open rebellion in this county on whether it's the outdoor dining or various other rules, because I think in other places, the rule makers, they're losing the credibility necessary for people to understand that the rules they make have some semblance of sense. And I'm going to read something that's I don't know if it's in the Bay Area news group papers today, but there's an editorial running in the Southern California news groups papers, and which together may have as much, if not more, circulation than the Los Angeles Times. It's about 11 newspapers. Now, interestingly, it's an editorial that has nothing to do with COVID-19 and nothing to do with pandemics and nothing to do with the golf industry and nothing to do with outdoor recreation. It has to do with their sort of praise of General Motors for standing down in the federal lawsuits against California's air standards, and pointing out, and there's just a line in here that I think should be an admonition for all regulatory bodies. And I'm just going to read it. Regulation happens, and when it does, it works best for all concerned when companies and government negotiate rules in harmony and continue to stay in the closest communication about ways forward. That's the way we do it in the golf industry, mostly at the water level with state agencies, all kinds of local public utilities and water districts and so forth, usually on the land use and the conservation side. It's how we work with park districts and park bodies across the state, and it works very well. And it's the mindset that often applies in those agencies that have long track records at adopting regulations. And the truth of the matter is, most public health departments they are not the developers of policy so much as they are the enforcers of policies that are developed elsewhere. A little bit of the State Water Control Board function in comparison to the Department of Water Resources at the statewide level. One is the developer and works well with industry. The other one is the cop. After those policies are developed, have to go out and enforce them. And I think we're seeing a little bit play out here in this crisis, in this pandemic, in that we've reposed a lot of policymaking responsibilities on bodies that are not used to it, not adept at it, and not particularly skilled at it. It's been thrown at them, and some have handled it very well. We're about to hear, I think, from a public health officer in Solano County who's handled it extremely well, and I'm grateful for his contributions. Some have not handled it so well, and I don't mind saying publicly that Los Angeles County Public Health has not handled this well at all, and that we are going to run into some problems longer term because of that loss of credibility. I think if Dr. Mattias is with us, I'd love to yield the floor because we don't get that much opportunity. Again, as someone in Los Angeles County who's never been able to get an audience with anyone really from public health in LA County, I relish the opportunity to hear from someone who's right on the line, experienced, and very grateful that he's willing to, on a repeating basis, and particularly today at this moment, willing to share it with us. So I don't know, Len, maybe Tom knows whether Dr. Mattias is with us yet, and whether and know whether I've yielded the floor at just the right time when he's ready to take it, or whether or not I've yielded the floor perhaps when he's not ready to take it. So direct me.
Craig, thank you. So Dr. Mattias is not yet with us, Craig, but we do have a couple of questions,
Okay.
and why don't we head there? Again, thank you, Craig, for that update. So is the 15% cumulative, or does the stay-at-home begin if only one region or county reaches the 15%?
It's by region. So it's all the counties in a region. And what it is that is an aggregate number of the hospital capacity throughout counties. Because I believe the reality, and ask Dr. Mattias this question, you know far better than I. The reality is that that's the way in which public health is delivered. It doesn't stop at the county line. It operates regionally. So it's when the region hits it. Now, like I said, the Bay Area has the most capacity at the moment. And if things go really well in the next week or so, they may never enter it. So it could be that 80% of the state goes into these regional stay-at-home protocols, and one doesn't. That also, I think, in the government announcing this in advance for a twofold purpose. One, to warn us, get us ready. And second, maybe to create powerful incentives for everyone to perhaps wear masks and socially distance and stay at home as much as possible. And as a result, maybe never get to that point. That's my reason. At least that's my take on probably why he did what he did yesterday.
Okay, Craig, thank you. And I see another question that says Penmar is only allowing those from same household, 4-person groups only. If you are 2 from the same household and want to play as 2 and purchase the other 2, they do not allow that. Only 4 from the same household. So again, it gets pretty tricky out there, doesn't it?
It gets tricky out there, and municipal systems, for obvious reasons, have, everything must be by electronic reservation protocol for clear reasons. You don't want people showing up and waiting lists and so forth as walk-ons. So I think the city they'll find their way. And I think that's a City of Los Angeles golf course. And what they're trying to figure out is to ensure that anyone who plays golf under this particular safer at home order in LA County is only playing with someone they know that they've made the tee time with. So, and again, I think there are other reservations systems and other municipal programs in LA County that can handle that sort of separation in a way without combining them. It could take a couple of days to work it out, but there are going to be these anomalies, and I would hope that golfers would be extremely patient and recognize that these municipal programs are doing their best to actually keep these golf courses open and at the same time consistent with orders that are not particularly well written. And in this case, were written in contravention of the advice that's been given them by their own Parks Department in LA County. And that's almost a sui generis situation. That's really not going on elsewhere. It is here. I suppose when all this is over, others will unravel all this and figure out why it didn't go as smoothly as it could have or should have.
Okay, thank you, Craig. And Dr. Mattias is on. And first, a little background. Dr. Mattias, thank you for joining us once again on our California Nevada chat. Certainly the timing is perfect with everything that's gone on in the past 72 and 96 hours. And Dr. Mattias is the current health officer and deputy director for Solano County for more than 10 years now. And recent prior posts include various roles with the California Department of Public Health as medical director of the epidemiology program in the Massachusetts Department of Public Health. Dr. Mattias received his medical degree from the University of California, San Diego School of Medicine and completed a residency in occupational medicine and preventive medicine at the Harvard School of Public Health, where he also received a Master of Science degree in epidemiology and Master of Public Health degree. So again, Dr. Mattias, thank you for joining us. I certainly appreciate you taking the time out of your schedule. And I will say personally that we've developed a nice relationship as a resident of Solano County, and our office is in Solano County, of the support we have received from Dr. Mattias in the golf industry. Conversations we've had about getting back to teaching, conversations we've had about riders in golf cars and being able to stay open. And Dr. Mattias has been quite a supporter and proponent along the way. So Dr. Mattias, we have in the news vaccines, we have regional stay-at-home orders, and on and on. So thank you for being with us, and it's all yours, please.
Thank you for the invitation, Lynn. Yeah, so I mean, everybody, I think, on the call is aware that the entire country, certainly our region, is experiencing very, very significant increases in COVID-19 disease. I think that pretty much region-wide, the counties are seeing more cases being reported here over the last couple of weeks than at any time before in this outbreak, even bigger numbers than what we had in the first surge in the summer. The only saving grace to date has been that a lot of the cases have been younger. And so while they are being hospitalized in record numbers, they haven't required ventilatory and ICU support in the same proportion that was the case earlier. If they were requiring it in the same proportion, our hospitals would already be crying uncle at the level of impact that that would have caused. The problem, though, is that Thanksgiving and the effects of Thanksgiving are now becoming felt. And Thanksgiving and the December holidays, all the way through New Year's, are multi-generational holidays. So up until now, the biggest impacts have been caused by Halloween and football weekends. And those tend to be younger people that are relatively healthier. But Thanksgiving forward through New Year's involves people of all generations getting together with family events. So our concern and the underlying driver for the governor's most recent regional approach is the fact that we're going to see older individuals included among the cases in bigger numbers, resulting in more severe hospitalizations and higher rates of death than what we have been observing over the past 2 months. So the idea is to try to protect hospital capacity by tightening things down as hospital capacity gets less available. And so I do agree with the governor on a regional approach to hospitals, because hospitals are not islands. They can move patients to nearby hospitals if they're overwhelmed, et cetera. So really the movement of patients is regional in nature. And so looking at this as a regional issue makes sense. I'm not entirely sure I agree with the metric, because the metric is available ICU beds, and that's a very dynamic number. Almost every hospital has more beds available than they have staff to cover. And so the staff coverage of beds is an important number, but they can also move staff around. And so what is reported as available beds underreports what is genuinely available. But at the same time, sort of the counter to that is that healthcare workers are also being impacted by COVID. Now, it's important to know that they're not being impacted in the work environment. It's not like we're getting hospital outbreaks, but hospital employees are members of our community. And they, like members of our community in every other business sector, are experiencing illness as well. So they're having trouble staffing beds. And I think the difficulty in staffing beds counterweighs the fact that there are more beds available than they report, so that what is reported probably is the best metric available, but it's not necessarily completely accurate. So the question that one can ask is, why wait till it drops to 15% capacity when you already know that by then there are several weeks worth of patients already in queue to end up in the ICU? Why not do it, earlier on in the process? And I think the answer to that is that there just is no perfect metric for how to measure the disease, or how to measure the impact of the disease on hospitals. So I see it as sort of the best compromise that the state's able to come up with. So that notwithstanding, I think all of us agree that the biggest reason for this increase in disease has to do with people getting together with friends and family and dropping their guard and spreading the disease in family and social get-togethers. And while some of those may occur at restaurants and bars, given the restrictions in that environment, I would say almost all of it in Solano County is occurring in people's own private homes. So the reaction to return to a stay-at-home stance that we had back in March in response to the hospital impact, I take issue with, because what is different today from March is that most of the small businesses that are operating have invested heavily in making their environment safe against transmission. I mean, take your own environment. You require online registration, you limit parties, you limit to families, you limit the number of people that can be on a vehicle. I mean, you've taken great pains to create an environment where golf can be maintained in a way that does not transmit disease. And that's also true for the personal services sector, for barbershops, for nail salons, et cetera. If you walk into one of those in the county now, what you see is a tremendous amount of investment in barriers that separate. They limit the number of people. Everybody's wearing masks. So I think, unfortunately, all of that is going to be harmed by this sort of sweeping decision to go back to where we were in March, as opposed to focusing on where the problem is actually occurring, and that is that people are not taking proper care when they're with family and friends. So I don't know to what extent there will actually be benefit to these regional stay-at-home orders when they're implemented, because if the public at large doesn't actually in large numbers change their behaviors, then the disease isn't going to change. The path of the disease curve is not going to change, and we'll continue to have large amounts of transmission. The hospital impacts won't diminish, and all we will have done is further harm businesses. We are in a different place in December than we were back in March. And I don't, one of the things I do take issue with is that I don't believe that the state is properly taking that into account with the orders that it issues. Strictly speaking, if they were to go back to the earliest stay-at-home stance, then outdoor recreation would have to stop. And yet we all know that outdoor recreation now is performed very safely, and we've had no transmission events occur at all at golf courses or other similar outdoor recreational venues. And that's information that should be taken into account in this decision making, but really isn't. So that's sort of my take on all of it.
Thank you. Dr. Mattis, would you talk, please, about the vaccines? There's been news, and even in the opening remarks, I mentioned Governor Sisolak in Nevada is expecting some vaccines there next week. So how it all works and the distribution and timing and such.
Yes, so the way it works in our country is that a vaccine manufacturer has to apply to the FDA for emergency use authorization. If the FDA believes that the data from their vaccine trial shows safety and efficacy, then they grant that approval, and then that manufacturer can begin to distribute vaccine. In the US, in an emergency like this, what happens is that the distribution of vaccine is centralized, and essentially CDC controls the movement of vaccine from the manufacturer out to the states, and then within the states to the local level. So in the initial phases, what will happen is small amounts of vaccine will be distributed out to the states, who in turn will get it to the local health departments to be able to provide it to hospitals. The first group of people to be vaccinated will be healthcare workers in hospitals. And as more and more vaccine becomes available, more and more groups will become vaccinated, moving from hospital workers to people who work in long-term care facilities and other congregate environments, as well as the fragile elderly in those environments, and then out to the next group of first responders, which would be your clinic physicians, fire and police, and then ultimately out to the general population. At the outset, the vaccine will flow from the manufacturer through the state to the local department to then send to the hospitals. But as the volume of vaccine increases, there will emerge a parallel private sector distribution and public sector distribution. So the private sector distribution will be direct delivery to healthcare environments, both for their own staff, but also for their patients. And then a separate delivery stream to local health to take care of the homeless and those people with no health insurance and congregate facilities. And we've done this in the past. We did it with H1N1 in the 2009 pandemic, and we've done it in really bad flu years, this sort of controlled process for delivery. The earliest vaccine to be delivered will be the Pfizer product, which is unfortunate because that has severe cold chain distribution requirements that are very difficult to implement. But we do anticipate Pfizer vaccine becoming available in the next week or two. So the Nevada governor is maybe a tiny bit hopeful, but certainly we think that by the second half of December, we will start to have a flow of vaccine. But the expectation is that California as a whole will receive about 400,000 doses in the first batch. And there are 300,000 healthcare workers that are targeted for that. So they are, you're not likely to see available vaccine at CVS or at your doctor's office in December. More likely, it'll probably take till February, March, maybe April before enough vaccine is distributed that your healthcare provider will say, yep, come on in, let's get you vaccinated. Or you'll be able to go into a walk-in like a CVS or a Safeway pharmacy. Eventually, it's going to be distributed through all of those different outlets so that people will have multiple ways of getting access to it. But the tricky thing to remember is you need to get 2 doses properly timed. So both the person who gives you the vaccine and you who receive it need to pay attention to the timing of your doses, and you need to go back to the same place and get the same vaccine. Because on the heels of the Pfizer vaccine will be the Moderna vaccine, expected to be trailing by 1 to 2 weeks. It does not have the same cold chain requirements. It's more of a standard vaccine that only requires refrigeration. But the timing for the doses is different for those 2 vaccines. Their formulations are different, and you can't intermix them and expect them to work. So it's going to be a bit of a logistical issue to keep track of the timing of vaccination so everybody comes back at the right timing and gets the right vaccine. And then it'll be further complicated sometime in January when the 3rd manufacturer's vaccine, AstraZeneca, also becomes available. So right now there are 3 vaccines considered to be effective and safe. We anticipate this FDA to approve Pfizer, followed by Moderna, followed by AstraZeneca over the next month. And each of those will start to come out in a trickle and then build up to more of a flow by spring.
So, Dr. Mathias, thank you. And I understand that Pfizer will be rolling out in the UK next week. So I would imagine there's much to learn there. Certainly that's good news. Much to learn there about the supply chain, much to learn about distribution, and much to learn about the effects and the results of the implementing the vaccine themselves.
Yeah, I don't actually think any of this is intellectually difficult to make sense of. It's just you have to actually do it. So, in order to maintain vaccine at -70, ideally you want to have a deep freezer. And everybody's trying to order those right now. And they're all backed up to till January in terms of getting out, because this isn't a type of refrigerator or freezer that you would normally have any reason to have. And so there's only one manufacturer of the, well, actually there's 3 now. 3 people manufacturing those freezers in the US. So it's not like you can just go to Home Depot and buy one. So like in our county, for example, we're actually trying to acquire 8 of them so that we can have enough storage capacity for the Pfizer vaccine. But while we wait for that, there is a backup plan, and the backup plan is to use dry ice. It just means that we have to receive and deliver it into people's arms much more quickly because we can't store it for any length of time. But that's okay. That's not a bad problem to have. It just means you have to think ahead to who you're going to vaccinate and then be ready to rock and roll once you get the vaccine. The actual logistics of delivery, the supply chain process for delivering the vaccines is the same one that's been in use for vaccines for decades. So there's really no rocket science involved in doing it. There's just this extra attention that has to be paid to not letting the vaccine thaw, and at the same time, making sure you keep track of who got which vaccine so you give them the correct one the next time.
Thank you, Doctor. We have one more question. If the stay-at-home protocols are enforced, it does mention no youth sports. In your opinion, would that also mean that our junior golf activities would need to cease operations?
Unfortunately, I think that's how the state would interpret it. You can argue that golf for the individuals practicing it is fitness and get away with it not being called sport per se. But when you're actually bringing youth together for the purpose of a golfing training process, it's a little bit trickier to define that as fitness rather than a group activity. And so part of the problem with the order is that it's going to go back to this idea of essential, non-essential. And so youth sports are definitely going to be thrown in the category of non-essential. Pro sports will be considered non-essential. So tournaments would be problematic. But I don't believe that they're going to say exercise and fitness is non-essential. So I believe that we can continue to operate most of the courses in the current paradigm with no difficulty, even under the stay-at-home order.
Okay, and then one other, please. Do you believe there will be some downtime from the reported side effects or immune reaction to the vaccine that might in turn affect the availability of the healthcare or hospital workers, thereby affecting the staffing available you mentioned for the hospital beds? Wouldn't this affect the rate of vaccination of healthcare workers and prolong the current restrictions?
Yeah, and because we expect that, we have insisted that in hospitals that they vaccinate in a random way by shift so that you don't get an entire shift of people vaccinated at the same time and out at the same time. So yeah, there is going to be some downtime based on the vaccination, several days probably, but we're already experiencing downtimes of 2 weeks because of illness and exposure to illness. So the hospital system is being strained even now because of disease, and temporarily the vaccination will strain them further. But the hope is that on the other side of that, they're no longer going to have staff out ill. So, everybody tolerates side effects individually. I mean, for some people, having aches and pains because you were vaccinated is like, oh yeah, I know why, I'm not worried about it, I'm going to go into work. For others, it's an opportunity to stay home. So none of that's going to really change. So the short answer to the question is yes, that is a concern, and that's one of the reasons why it's important for hospitals to time vaccination for various groups of providers intelligently.
Okay, we have one more that just came in. What would be the protocol if one of your juniors in your golf program is reported to be positive? Last attendance was 2 weeks prior, reported 2 to 4 days before upcoming event. What guidelines should be given to parents, and how long until that junior could return?
If a person reports as positive, they need to isolate for 10 days, so they can't return until their 11th day. The people that they have been in contact with during their infectious period, and the infectious period is 2 days before the onset of symptoms until 10 days after the onset of symptoms. So anyone that they exposed in that time period would in turn need to be quarantined. And that quarantine period is for 10 days as well, that they would need to stay away from the facilities. But the question becomes, who is a close contact? And the basic principle to apply in figuring that out is sustained, close, unprotected contact. So basically what that means is that people who the case was within 6 feet of for 15 minutes or more cumulatively, with one or the other not wearing a mask. If they're both wearing a mask, in theory, that should protect against transmission, even with close physical proximity. But if people are in close proximity for a long period of time, and they're not adequately protected in terms of their face and their nose, their nose and mouth, then they would be considered a contact, and then that person would have to be out for quarantine.
Okay, thank you very much.
I was going to say, with regard to the specific question noted, if the last exposure to fellow golfers was 14 days ago, well, it's too late to quarantine anybody. So at that point, I wouldn't do anything.
Right. Okay, thank you. Lynn, that's all the questions that we have at this time.
Okay, Nikki, thanks. And another that just arrived, Dr. Manny. So what temperature will the Pfizer vaccine enter the body?
Well, it's going to enter the body at room temperature, just like any other vaccine, but it has to be stored at -70. Once it's thawed, you have to use it within a couple of hours. And so what will happen is vaccine will be moved to the location where the vaccinations are going to be given. A couple of hours before people start to show up, it'll be removed from deep freeze and thawed, so that by the time you're actually getting the injection, it's going to be at the same temperature as every injection.
And Dr. Manny, thank you so much for the insight, particularly as you mentioned earlier on about the multi-generational holidays that are coming up, and certainly that's cause for concern. But we've talked about so much this year, and let's wash our hands, let's wear our face coverings, let's socially distance. Do you have any others to add to that list as we move into the winter, as we move into flu season, and of course, as you say, as we move into these multi-generational holidays?
Well, certainly I would add to the list of things to do, getting a flu shot. Bad your experience might be with COVID, it'll be a lot worse if you also have flu at the same time. And your body can only handle so many insults at a time. And one of the things we see happen to a lot of folks in the winter is they'll get one respiratory disease and then immediately get the next one because their immune system was weakened by the first one. So at minimum, it's really helpful to protect yourself against the flu because we do have a vaccine for that. And then once COVID vaccine's available, then certainly the recommendation would be to get that vaccine as well. The things you want to do are really mostly driven by common sense, and they're going to sound mundane and boring, but they really work. In general, you want to maintain your health. You want to make sure you eat well, that you get plenty of rest, that you exercise, so that your body is healthy and your immune system is competent as it can be if you are exposed to the virus. In your gatherings with friends and family, and you will gather, and there's nothing I'm going to tell you that's going to prohibit you from gathering, because people value family and friends tremendously. So people will get together. You have to practice harm reduction, minimize the likelihood of the virus transmitting. So one thing to keep in mind is that the virus, the likelihood of becoming sick is dose dependent. The more virus you're exposed to, the bigger your chance of getting sick. So minimizing contact is way better than not minimizing contact. Obviously, no contact is even better because then there's no way to transmit. The other reality is that it's transmitted through your saliva from one person to the other. So think about how saliva transmits and try to break that chain of transmission. If you're coughing or sneezing, you have no place getting together with other people because you will expose them, and that's just not cool. But if you're otherwise not coughing or sneezing, then the way you're going to transmit it is either by being physically close to one another and talking loudly, animatedly, and spitting with your talk, and or through what are called fomites, your saliva getting onto something that then gets into the next person's mouth. So where are the lessons there? The lessons are, when you're talking with family and friends, back up a little bit and be a little bit further apart. People aren't going to wear face masks in a personal gathering, but they can be a little bit further apart from one another. Hug briefly and back away. Don't kiss, or if you're going to kiss on the cheek and back away. Those are all things that will reduce transmission and dose of transmission. And then because of this risk of saliva transmission, pay attention to your hands. Don't ever bring your hands to your face without first washing them or disinfecting them. Then even if there is virus on your hands, it won't complete the chain of transmission. Don't share food. Don't share drinks. Don't share cigarettes. Like, when I say share, I mean drink out of the same cup or use the same fork or double dip. If you don't do those things, then the likelihood of transmission on fomites goes way down as well. So that you can, in theory, interact with family and friends, and by doing these things, greatly reduce the risk of transmission. The other thing I would add to it is cocoon the elderly. Like, be especially careful not to let people get too close to those members of your family who are older and are more likely to have a bad outcome of the disease. So, I'm not an unrealistic person. I'm not going to say just don't get together with family or do everything remotely, because that's just not realistic. But what is realistic is getting together in a way where you respect each other's boundaries and try to maintain as much prevention of saliva transmission as possible.
Okay, Dr. Mathias, thank you. And we do want to respect your time again for everything that you've done for us and being on this chat. I believe this is your third time with us, and everything locally and your support for golf and what we've accomplished. So thank you so much, and we'll stay in touch as we move along.
Yep, thanks. And thanks again for inviting me. Good luck, everybody.
Okay, ladies and gentlemen, that's just tremendous information from Craig today, and of course, Dr. Mathias, as we head into the Christmas season. And just a reminder, this is our last session for the year. We will pick it up next year and continue on. We still have much great work to do, and I'd like to at this point start to wind down and head to our section president, Dee Dee Moriarty, one more time.
No, thank you, Len. Dr. Mathias and Craig, thank you for the wonderful information today. information is what keeps us strong, and it's so important. So I want to thank you very much, and we'll look forward to be looking forward to the new year. So Len and Tom, thanks for keeping these chats going, and we'll talk soon.
Thank you, Dee Dee. Tom?
Yeah, thanks, Len, and thanks, Dee Dee. Tony, would you like a few last words before the holidays and the new year?
Thanks, Tom. Yeah, I'd just like to say happy holidays to everybody, and whatever it is you celebrate in your family, I hope you are able to at least do that in some capacity and have a Merry Christmas, Happy Hanukkah, Happy New Year, whatever it is you celebrate, enjoy. I've enjoyed, I just will leave with one quick thing. This will be my last call as the president of the section, so look forward to turning it over to Robin Shelton next year on these calls. And Dee Dee, always fun serving with you, and we'll hopefully see you all soon. So thanks for everything. Thanks for all the information, keeping us apprised of what's going on, Craig and everybody and Doctor, and appreciate you all very much. So have a happy holiday.
Thanks, Tony. And I wish everyone the same. Don't let your questions stop. If you have, excuse me, if you have any questions as time goes on through the holidays, and if these new protocols are laid down, send us a question. You can send email myself or Len. I don't know if that screenshot of our addresses is available, Bryce, but in the case it is, if we could pull that up. And even Craig, I shouldn't say even Craig, and Craig. We'll answer your questions, and we'll continue to answer your questions, because we have, as Len mentioned, and we listed, we have numerous contacts that are extremely valuable, and we'll be able to help in that regard, and encourage you to do so. But have a great holiday. We look forward to the next one next year. We'll keep you informed as to when that is, and hopefully it'll be good times, and we'll be in good stead when next year rolls around. And thanks so much. Len?
Yeah, thank you, Tom. Tremendous attendance today, over 80 attendees. So we can't say enough about the support. We also can't say enough about the respect for everyone, all the operators out there, and staff members at the facilities. And we've talked about this quite a bit, who have been on a daily basis adhering to the protocols to keep us as an industry in good favor, in good light, and open. We've seen that as we go to facilities. We've seen the plexiglass on the counter. We've seen the temporal thermometers. We've seen the checks that are going on. We've seen the separators in the golf cars. We've seen the times being staggered, and people staying away from each other, and only to a large extent a certain number of people allowed in the golf shop at a time, if they're allowed in at all, or into the clubhouse. So the to-go dining, this is not easy by any means, yet everybody is adhering to the protocols. Has just been tremendous, and an example of the fact that we take this very, very seriously. And as Dr. Mattias said, we're providing health, not only physical health, but mental health, and we appreciate the respect of the health officers and legislatures in allowing golf to continue. So to everyone, the best to you all. To Carol, many times retirement is busier, and what we foresee at this moment is you might have some time to actually make more banana bread next season for all of us, which would be great. And best to all, as Tony mentioned, whatever holiday that you celebrate, please stay close. Please stay in, and I say close in that way of communication. Please stay in contact with us, and anything comes up, just let us know, and we'll do the best we can to help or find the help that's needed. Thank you so much. Enjoy the weekend. Happy holidays, and we'll talk soon.
Happy holidays, everybody.